Hello, my friends. I'm Dr. Candace Pert, urology and mind-body wellness educator. And today we're going to talk honestly about a topic that almost no one explains clearly to men over 65, the truth about ejaculation in later life. For decades, you've probably heard that after a certain age, you should slow down, that intimacy is dangerous for your heart, that ejaculation will drain your energy or worsen prostate problems, or that a man is too old to feel desire. Yet when we look at how the body truly works, a very different picture appears. The mature male body is not broken, it is adapting. And when you understand those changes, ejaculation stops being a source of miedo or confusion and becomes what siempre debió ser, a natural expression of vitalidad, conexión y bienestar. Let's begin by acknowledging something important. If you are over 65, you have already gone through decades of physical, emotional, and hormonal experiences, medications, surgeries, stress, chronic illnesses, wins and losses in life. Everything leaves a trace in your body, so it is completely normal that ejaculation at 68 does not feel the same as at 28. That does not mean it is worse or dangerous. It means your body is asking for a new ritmo, a new level of awareness and cuidado. The goal of this conversation is not to push you to be more active or to measure your worth by performance. The goal is to give you clarity so you can make decisions from confidence instead of fear. To understand ejaculation after 65, we need to understand what actually happens in your body during this process. When you feel excitement, your brain sends signals through the spinal cord, increasing blood flow to the pelvic area. The prostate, seminal vesicles, and small glands in the pelvis begin to produce and store fluid. The muscles at the base of the pelvis, especially around the urethra and rectum, contract in coordinated rhythms to propel that fluid outward. Your heart beats a little faster, your breathing changes, and the nervous system goes through a brief, intense wave of activation and release. This sequence is a natural, programmed response. It is not a defect, it is not an accident, and it is not something the body forgets just because you add more candles to the birthday cake. With age, however, several elements of this system change. Testosterone gradually declines, but it rarely disappears completely. Blood vessels lose some elasticity, which can affect how quickly and strongly blood flows into the pelvic area. Nerves can become a bit less sensitive, especially in men with diabetes, long-standing high blood pressure, or spinal problems. Muscles in the pelvic floor may weaken if you've spent years sitting, avoiding exercise, or dealing with prostate surgery. The result is that ejaculation can take longer, feel different, produce less volume, or require more direct stimulation. None of this automatically signals disease. It signals adaptation. Your body is saying, I still function, but I need a different rhythm and better cuidado. One of the biggest fears for men over 65 is the idea that ejaculation is dangerous for the heart. Many men tell me, Doctor, I'm afraid that if I get too excited, my heart won't handle it. Here is the truth. For the majority of older men with reasonably controlled blood pressure and stable cardiovascular health, moderate sexual activity and ejaculation are not only safe, they can actually support well-being by improving circulation, mood, and sleep quality. The moments when we worry are very specific: severe chest pain with minimal effort, shortness of breath at rest, or heart disease that is not under medical supervision. In those cases, any physical exertion, including climbing stairs, can be risky. The solution is not to demonize ejaculation, but to make sure your general health is being taken care of. Another persistent myth is that ejaculation empties your vitality irreversibly, as if every time you release fluid, you lose strength you'll never recover. That image creates guilt and fear, especially in men who already feel more tired because of age, medications, or chronic illness. The body does not work like a battery that discharges and never recharges. Seminal fluid is produced continuously, and the hormones related to desire are regulated primarily by your overall health, sleep, nutrition, stress, exercise, and emotional state. In a balanced lifestyle, ejaculation is usually followed by a natural phase of relaxation and recovery, not permanent exhaustion. If you feel destroyed for days after a single episode, that is not proof that ejaculation is harmful. It is a sign that your system may be overloaded, and your energy reserves, cardiovascular health, or emotional stress deserve attention. Now let's address the question almost every man silently carries. How often should I ejaculate after 65? Many are looking for a magical number. Once a week, twice a month, every day. The truth is that there is no universal frequency that is healthy for everyone. What matters is how your body and mind feel before, during, and after. If ejaculation leaves you calm, relaxed, more affectionate, sleeping better, and with a sense of bien-estar, it is a functional pattern for you. If, on the other hand, you notice headaches, palpitations, intense fatigue, irritability, or pain in the pelvis or genital area afterward, that is feedback from your body that the frequency, intensity, or conditions are not aligned with your current health. You are not a young athlete. You are a mature man with a history. Your ideal rhythm is unique. Many men also wonder about the relationship between ejaculation and prostate health. Some are told that frequent ejaculation protects the prostate. Others hear the opposite, that it wears it out. Reality is more nuanced. The prostate is a gland that produces part of the seminal fluid, and emptying that fluid regularly can help keep secretions moving. However, prostate health depends much more on inflammation, hormones, genetics, body weight, circulation, and metabolic health than on a specific number of ejaculations per week. If you have enlarged prostate, you may notice that ejaculation temporarily increases urinary urgency or mild discomfort. Some men feel the opposite, a sense of relief afterward. The important signals to pay attention to are persistent pain, blood in the semen, burning, or a strong change in urinary habits. Those are reasons to consult, not to blame ejaculation itself. Another truth that is rarely discussed is how medications influence ejaculation after 65. Many common drugs for blood pressure, depression, anxiety, chronic pain, or prostate enlargement can interfere with arousal, the ability to reach climax, or the amount of fluid released. Sometimes the body is ready, but the nervous system is chemically braked, and men interpret this as failure or loss of masculinity. Understanding that a pill can slow or modify ejaculation is not an excuse. It is information that empowers you. It allows you to talk with your healthcare team about adjusting doses, changing schedules, or exploring alternatives, instead of silently suffering and assuming your body no longer works. Let's talk about situations when ejaculation does deserve more careful evaluation in older men. If you cannot reach ejaculation despite feeling aroused for a long time, this can be related to nerve issues, medications, diabetes, or previous surgeries. If ejaculation is very painful, that may signal infection, inflammation of the prostate, or tension in the pelvic floor muscles. If you notice that fluid goes backwards into the bladder instead of outward, you might experience cloudy urine afterward. This retrograde ejaculation is often benign, but can be a side effect of prostate surgery or certain medications. None of these situations mean you must abandon intimacy. They mean your body is asking for guidance, and with proper evaluation, many of these patterns can improve significantly. Beyond the physical, ejaculation after 65 is deeply connected to the emotional story a man tells himself about aging. Some see each passing year as proof that their value declines, their desirability fades, and their role in a relationship shrinks to silence. Others discover that, released from the pressure to perform like in their 20s, they can finally relax and enjoy touch, connection, and affection without a stopwatch in the mind. The same bodily event, ejaculation, can be experienced as defeat or as celebration, depending on the meaning you give it. When you stop measuring yourself only by firmness, speed, or quantity of fluid, you open space for a far richer, calmer, more conscious intimacy. This is where one of the biggest shifts after 65 often occurs, moving from performance-driven encounters to connection-driven experiences. For many couples, focusing less on forcing ejaculation and more on shared tenderness. Breathing, conversation, massage, and slow touch brings more satisfaction and less anxiety. Ironically, when the pressure to finish is reduced, ejaculation often happens more naturally, without fight. Your nervous system functions best in a state of safety and confianza, not under the threat of failure. This means that cultivating emotional intimacy, speaking openly about fears, and laughing together about the adjustments of age are not extras. They are as important for ejaculation as blood flow and hormones. Now, what can you do in daily life to support healthy ejaculation and intimate well-being after 65 in a natural way? One of the most powerful tools is gentle movement. A simple habit like walking 20 to 30 minutes most days improves circulation to the legs, pelvis, and heart, supports blood pressure regulation, and helps maintain a healthier weight. Better circulation means better response when the body receives signals of arousal. Another underrated practice is strengthening the pelvic floor. Conscious contractions and relaxations of the muscles you would use to stop the flow of urine can improve control, intensify the feeling of release, and support continence. These exercises do not require gyms or equipment. They require constancy and attention. Nutrition also plays a role. A way of eating rich in vegetables, fruits, healthy fats, nuts, seeds, and high-quality proteins helps reduce inflammation and protects blood vessels. Excess sugar, ultra-processed foods, and heavy alcohol use, on the other hand, progressively damage the same arteries that carry blood to the heart and the pelvic area. There is no magical superfood that guarantees perfect ejaculation, but a body that is less inflamed, better nourished, and more stable in its blood sugar responds more predictably to desire. Hydration is equally important. Thick, viscous blood does not circulate as easily, and even mild dehydration can affect energy, concentration, and overall comfort. There is also a mental component you can train. Before intimate moments, taking a few minutes to breathe deeply, slow down, and bring your attention to the body, instead of letting the mind race, reduces performance anxiety. Many older men are so focused on whether they will respond, whether they will ejaculate, whether their partner will judge them, that their nervous system enters a state of fight or flight rather than relaxation. In that state, the body prioritizes survival, not pleasure or release. Simple practices like inhaling slowly through the nose, exhaling longer through the mouth, feeling your feet on the ground, and noticing the warmth of your partner's presence can gently shift you into a safer internal environment where ejaculation becomes easier if and when it needs to happen. To make these ideas more concrete, imagine Arthur, 72 years old, who came to a consultation convinced that one more ejaculation would finish off his heart. He had read alarming headlines and started avoiding any intimate contact out of fear. His blood pressure, however, was well controlled. He walked daily, and his cardiologist had cleared him for moderate exertion. When he understood that his fear was based more on myths than on his actual health, he began to reintroduce tender moments, at first without seeking any climax. Over time, as his confidence grew, ejaculation returned naturally, not forced, not constant, but present. What changed his life was not a pill, but knowledge and confianza. Now think of Miguel, 68, who felt frustrated because nothing came out after years on prostate medication. He interpreted this as proof that his body was broken. In truth, his drug relaxed the muscle that usually prevents semen from entering the bladder, causing retrograde ejaculation. With a simple explanation, he realized that his body still went through arousal and release. The path of fluid had simply changed. His priority was connection with his partner, not fertility. When he let go of the idea that visible fluid defined his masculinity, he experienced less anxiety and greater intimacy, even though the mechanics remained the same. Finally, consider Luis, 75, who experienced strong pelvic pain after each ejaculation and began to avoid any erotic stimulus out of fear. In his case, evaluation revealed inflammation in the prostate and excessive tension in the pelvic floor muscles. With treatment for the inflammation, adjustments in medication, and gentle stretching and relaxation exercises, the pain gradually diminished. He did not have to erase ejaculation from his life. He had to listen to the symptom as a message and respond with cuidado instead of shame. What do these stories have in common? In each case, the problem was not simply ejaculation itself, but the context, fear, misinformation, untreated health conditions, or rigid beliefs about masculinity and aging. When those layers are addressed, ejaculation after 65 can find a natural, respectful place in a broader landscape of well-being that includes emotional closeness, self-care, movement, and mental calm. The body, even after many years, has an impressive capacity to adapt when it receives understanding instead of criticism. So if we condense everything into one powerful sentence, it would be this: the truth about ejaculation after 65 is that it is not your enemy nor your identity, but one more expression of a body that still seeks connection and that functions best when you support its health, listen to its signals, and let go of fear. You do not need to prove anything to anyone. You do not need to imitate the rhythm of your youth. You need to honor the man you are today with your history, your scars, your wisdom, and your desires. Never forget, it is never too late to recover vitality. Each improvement in sleep, movement, nutrition, stress management, and emotional connection creates a more favorable environment for your intimate health. Even if you have gone through surgeries, illnesses, or disappointments, your nervous system and your heart remain responsive to care. Ejaculation may change with time, but your capacity for affection, tenderness, and presence often deepens. That depth is a treasure that younger men, obsessed with performance, rarely know. As we close this conversation, I invite you to reflect gently. What beliefs about ejaculation and aging have you been carrying that no longer serve you? Which of them come from your own body, and which come from fear, shame, or cultural messages? If something you heard today resonated with your experience, consider sharing it with a friend, a partner, or someone who might need this clarity. And if you'd like to continue exploring natural, respectful ways to support your health and vitality in the later decades of life, I encourage you to stay connected, leave your questions and stories, and subscribe so we can keep learning together. Remember, my friend, your value is not measured in frequency or volume, but in the quality of presence you bring to yourself and to those you love. Take care of your heart, your circulation, your mind, and your emotions, and your intimate life, including ejaculation, can adapt in a way that is kinder, calmer, and more aligned with who you truly are today.